As we age, the risk of stroke increases. Perhaps that comes as no surprise. But there is another player in the stroke story that may play a more important role, and that is hypertension. In the European Heart Journal, researchers report on the incidence of stroke in various European countries and try to make sense of what is happening over time. The aim was to understand international trends in stroke in Europe and countries peripheral to Europe by assessing current mortality rates, the most recent 15-year prevalence trends, and the relationship between systolic blood pressure in community surveys and national stroke mortality. Total numbers of deaths by stroke and the age and sex-adjusted incident rates were obtained from the WHO and countries grouped together. A Bayesian linear mixed effect model was then constructed. The results, it turns out, are fascinating. It seems we have entered a period of rapidly increasing international inequality in stroke risk. For both sexes, markedly higher death rates from stroke were noted moving from west to east. Countries with low stroke mortality in the latter 20th century, for example, France and Ireland, extended their downward trend, and countries with moderate and high mortality, such as Bulgaria, have on average seen unprecedented increases in death rates from stroke. Now, this is not good news, obviously, but the real question is, what is going on to produce this disparity? The answer may lie in hypertension and its treatment. If we assume that stroke mortality can serve as a proxy for average blood pressure in a population, the data from this study demonstrate the necessity to adopt actions to increase the diagnosis and control of hypertension in countries where the burden of hypertension sequelae is still growing. Policies to increase the rate of blood pressure control offer the best approach, while primary prevention strategies, of course, must also be implemented. I'm Peter Block, and this is a CardioSource Heart Minute.